what I'm going to do basically is to just go ahead and give you the opinion as far as what carriers and employers are doing because of the healthcare reform law. And what we're really finding is that the employers that we work with is that they are going to continue to offer the health insurance even, after all companies at some point will probably be able to get into the exchanges. But employers really do feel that they need to attract and retain good talent. So they do want to go ahead and offer a very good package. So what we're finding too is that the legislation, healthcare reform, is really tackling the access of care. And it's trying to make it affordable for low income. But beyond that, it's not doing anything in order to really reduce the cost of healthcare. So that's really what carriers and employers are really focused on, and that is solutions that can really bring a reduction in the cost of healthcare, but yet provide very high quality, and they're doing a lot of their focus is on innovation. So what we find, we know that there is definitely, our system is broken. We need to make some transformational changes. And so what we find is that employers cannot sustain the cost of healthcare. Healthcare actually is doubling about every 8 years. So that is a big nut for employers to handle. And so what we see is that employers and carriers are actually working together in order to have an integrated approach. So the mission for carriers really is to really promote healthier living. And at the Going Brave Bender, our big mantra is empowering healthier living. So what we're seeing is practical innovations that can really enhance quality, improve access to care, promote better health outcomes, and not to forget about the convenience of care, because with Americans, that's always something that has been high on our list. So carriers are actually creating accountable care organizations. They're helping to coordinate that. So an accountable care organization is basically where hospitals are aligning with primary care docs. And the whole focus there is to provide care so that the outcomes are better. So rather than have docs being strictly reimbursed for activity of service, it's getting to the point to where the drivers really should be that docs and hospitals should be reimbursed for outcomes. So that's where we kind of see things are going. And so there's a long way, and there's got to be quite an integration of service. So we also have these patient-centered medical homes. And what that basically is that your primary care docs should be the ones that are in charge of your total care and coordinating all your care, as opposed to having, going to specialists and going to different docs, and maybe no one central point really knows your total care. And so, but we are finding, and I've talked to various doctors, that there's also a concern when you go to this patient-centered home and you've got your primary care doc as the central point of your care, then you also have the issue of, do we have enough primary care docs? So we do see that as this is going to be a big promotion to actually increase the number of docs. So we think that there's going to be a big increase there for primary care. Plus the reimbursement is actually going to improve for primary care docs as well. So in essence, what we find is there really has to be a mind shift here, and that this is not a good stat, but it's something that we really have to. It's a true statement as far as 67% of Americans are actually overweight. 33% are obese, 67% are overweight. So we as Americans really have an issue. And so, we're looking at this from a full global perspective, and that this legislation is not going to take care of all of our issues. So we really have to make certain that hospitals and continue to work together in order to integrate the care. So technology is actually very much on the forefront here as really making a difference. Again, for cost and quality. Electronic health records, there's a lot of progress being made there that really needs to be accomplished before we can have an efficient system. And where we see a lot of the focus now is because of the obesity rate. We're finding that a lot of people, even young kids, are having type 2 diabetes. So we know we have to do something there. So the big focus now is carriers are really focused on wellness, and that there are tools out there where you can actually identify individual risk as far as who are the people who are probably going to have your next high claim. Who are the people who actually might be on the edge of getting type 2 diabetes or cancer. So there are tools out there that can actually help identify those people and then help them to improve their lives. So that, in essence, is going to reduce the cost of health care. As far as there's some price transparency tools that are out there. We feel that too. Where else would you go? And let's say if you were going to have services done, you just say, well, just go ahead and do it, and I don't care what it costs. I mean, nowhere else do you find that. So people really need to be much more informed as far as what do the services cost, and is there much of a difference between having colonoscopy at one facility versus another? And it's a huge difference. So we're putting tools in the hands of individuals so that they can actually do some comparative shopping, and they can actually check on the actual prices. Real quickly, as far as other really cool technology that's coming down the pike, and that is Watson IBM. I don't know if you saw the Jeopardy when they had the computer, and they were actually had the quiz where they were going against the computer. Well, that same technology is actually being used in the oncology field. And basically what it does is that it will go ahead and compile all the most current medical data, and based on the conditions and the symptoms of the individuals, it will go ahead and help the doctors to come up with the best practice. So I need to just probably wrap it up there, but I just got to say that the employers and carriers are definitely not looking at the healthcare reform as the answer, and they are very much actively involved in trying to do something in order to improve the system.